Gallstones. Imagine waking up in the middle of the night with a sudden, intense pain under your upper right ribs. You might think it's indigestion. Maybe you ate something too fatty. But what if the real problem is a tiny stone inside your gallbladder? Gallstones can be surprisingly small, yet they can cause severe pain and, in some cases, dangerous complications. So what exactly are gallstones? Why do they form? And how do you know when gallbladder pain is something you should never ignore? Let's break it down. What is the gallbladder? First, let's understand the gallbladder. Your gallbladder is a small, pear-shaped organ located underneath your liver. Its main job is to store and concentrate bile, a digestive fluid made by your liver. When you eat, especially a meal containing fat, your body releases bile from the gallbladder into the small intestine. That bile helps your body digest and absorb fats. But sometimes, substances inside bile become unbalanced. And that's when gallstones can develop. What are gallstones? Gallstones are hardened deposits that form inside the gallbladder. They can range from tiny particles, sometimes compared to grains of sand, to stones that are much larger. There are two major types. The most common are cholesterol stones. The second type is pigment stones, which are made primarily from a substance called bilirubin. Here's the important part. You can have gallstones without knowing it. Many people have what doctors call silent gallstones. Gallstones can develop when bile contains too much cholesterol or bilirubin, when the gallbladder doesn't empty properly, or when certain health and lifestyle factors increase your risk. Risk can also increase with factors such as being overweight, rapid weight loss, pregnancy, certain medications, family history, age, and some medical conditions. And here's something many people don't realize. Rapid weight loss can actually increase the risk of gallstones. So losing weight can be healthy, but extreme or very rapid weight loss isn't necessarily better. The classic warning sign? The most classic symptom is what's often called a gallbladder attack or biliary colic. It can cause sudden pain in the upper right part of your abdomen or the upper middle abdomen. The pain may be intense and steady. It can sometimes spread toward the right shoulder or back, and it may happen after eating, particularly after a heavy or fatty meal. The pain can last for minutes to several hours. Some people also experience nausea or vomiting. Warning signs you shouldn't ignore. But gallstones don't always stop at pain. Watch for these warning signs. Number 1. Severe or persistent abdominal pain, especially pain that doesn't improve or keeps coming back. Number 2. Fever or chills. This can indicate inflammation or infection. Number 3. Yellowing of the skin or eyes. This is called jaundice and can happen when a gallstone blocks the bile ducts. Number 4. Dark urine or unusually pale stools. These can also be signs that bile isn't flowing normally. A stone can move out of the gallbladder and become lodged in a bile duct. That blockage can lead to inflammation or infection. In some cases, it can contribute to a serious condition called acute cholecystitis, inflammation of the gallbladder. A blocked bile duct can also affect the pancreas and potentially trigger pancreatitis. That's why severe abdominal pain accompanied by fever, jaundice, or persistent vomiting should not be brushed off as simple indigestion. How do doctors diagnose gallstones? So, how are gallstones diagnosed? Doctors may start with your symptoms and medical history. A physical exam may follow. One of the most common imaging tests is an abdominal ultrasound. It can often detect gallstones and signs of gallbladder inflammation. Doctors may also order blood tests to look for signs of inflammation or problems involving the liver, bile ducts, or pancreas. Depending on the situation, additional imaging or specialized procedures may be needed. How are gallstones treated? Treatment depends on whether your gallstones are actually causing problems. If gallstones are found accidentally and aren't causing symptoms, treatment may not be necessary. But recurring or complicated gallstone attacks may require treatment. For symptomatic gallstones, the most common definitive treatment is surgery to remove the gallbladder, called a cholecystectomy. Today, this is often performed laparoscopically through several small incisions. And here's an important fact. You can live without a gallbladder. Your liver continues to make bile. It simply flows more continuously into the intestine instead of being stored in the gallbladder. In selected situations, doctors may use other treatments, but surgery is commonly used when gallstones repeatedly cause symptoms or complications. Can you prevent gallstones? Not every case can be prevented, but healthy habits may help lower your risk. Aim for a healthy body weight. If you're trying to lose weight, avoid extreme crash diets and very rapid weight loss. Choose a balanced diet with plenty of fiber-rich foods. Include fruits, vegetables, whole grains, and other nutritious foods. And stay physically active. Your goal isn't perfection. It's sustainable habits that support your overall health. The busting moment? Here's a common misconception. If I have gallstones, I definitely need surgery. Not necessarily. If gallstones aren't causing symptoms, doctors may simply monitor the situation. Treatment decisions depend on your symptoms, complications, overall health, and medical evaluation. So don't assume every gallstone requires an operation. But don't ignore recurring or severe symptoms either. Gallstones may be tiny, but the problems they cause can be anything but small. If you experience severe or persistent abdominal pain, especially with fever, chills, jaundice, dark urine, pale stools, or repeated vomiting, seek prompt medical care. If you found this explanation helpful, subscribe to this channel for clear, evidence-based health videos made simple. And share this video with someone who might need to know the warning signs of gallstones.